Hello, this is Dr. James Camp at Lee College in Baytown, Texas, and this is the endocrine system, Part B, the thyroid and parathyroid glands. The thyroid is a gland that's often described as being roughly butterfly-shaped. It's got two lobes connected by a small stretch in the middle called an isthmus. Most of the thyroid gland is composed of these spherical clusters of cells called follicles. The cuboidal cells that surround each follicle, such as this one here and this one here, look like your sort of standard simple cuboidal epithelial cells. And in fact, I use them for an example of that in my A&P1 class in histology. These cuboidal cells, as you know, are most commonly used by the body when it wants to secrete something. So these cuboidal cells are most notable for secreting the hormones T3 and T4 into this space in the middle of the follicle. But T3 and T4 are not water-soluble hormones. They are among the lipid-soluble set of hormones. And so to store them for a long period of time until they're ready to be released, they're packaged in this pink colloid substance here called thyroglobulin, TGB for short. And the colloid thyroglobulin can store up to 100 days of these hormones. So almost a third of a year's worth of these hormones can be stored in your thyroid when you're not using them. That's good because the thyroid hormones are the only hormones, the only substances in your body that are produced using the mineral iodine. And in primitive humans, and in some humans today, getting a reliable source of iodine in your diet was not very easy. So it's quite handy to be able to produce thyroglobulin with its T3 and T4 hormones whenever you have iodine available, and then store it until you need it. In between the follicles, there are these roughly triangular collections of cells called parafollicular cells, or C cells, C for calcium or calcitonin. These C cells secrete the hormone calcitonin in response to high blood calcium levels. So if the calcium in your blood is too high, for example, after just having a highly dairy-inclusive meal, the C cells in the thyroid will detect that high calcium level and secrete calcitonin in response. The parathyroid glands are much smaller, very unobtrusive glands located on the posterior side of the thyroid gland. And in fact, they were not discovered until somewhat recently because anatomists had never really thought much of these small lumps on the back of the thyroid gland. It was only when people started doing thyroidectomies to try to get rid of thyroid cancers that they noticed that if you did a complete thyroidectomy, a radical thyroidectomy, and you removed all four of these lumps, the patient would die. That's kind of a sad way to discover something, but they went back and tried to figure out what it was that the patient was missing. And it turns out that the chief cells of these parathyroid glands secrete the hormone parathyroid hormone, or PTH for short, in response to low blood calcium levels to help you maintain your blood calcium. Since the human body is actually really not very efficient at absorbing calcium, and a lot of people don't have a lot of calcium in their diet to begin with, you can go, your blood calcium levels can drop quite low, and parathyroid hormone is an absolutely essential part of your body's functioning because it will pull calcium out of your bones and direct your kidneys to reabsorb calcium when your blood calcium starts to be low. And as you remember from A&P1, key parts of nervous system and muscular system function depend on having enough blood calcium, as do several other things that we've studied in A&P2, such as blood clotting. The thyroid and parathyroid glands have an interesting histology. If you look at the two of them, you'll notice that if you look at the two of them side by side, you'll notice that the parathyroid gland has this just largely jumbled collection of cells. They're not really spaced this far apart, but I'm not very good at drawing them all super close together here on my computer screen. But you have this this pattern of cells I like to think of as the endocrine jumble. Okay, that you've got all of these what would be cuboidal cells, but they're not really arranged into cuboidal shapes. They're just sort of jumbled together, and every now and then you'll see a little blood vessel wedged in there, and the cells just secrete hormone into these little stretches of blood capillary to absorb the hormone and carry it all over the body. There's not really much organization needed in most endocrine glands, and so typically endocrine tissues don't exhibit very much organization. If you look at the thyroid side of the gland, on the other hand, you have, as we've mentioned, these thyroid follicles, where cuboidal shapes that, cuboidal cells that are organized into recognizably cuboidal structures secrete thyroid hormone and thyroglobulin into the middle of their follicle structures. So they secrete your T3 and T4 into the middle, and you end up seeing these collections of thyroglobulin here in the middle, thyroglobulin TGB. One interesting note: if you look at the thyroglobulin, you can tell whether that follicle is actively releasing its hormone or storing its hormone. If it's storing the hormone, the area will be pretty much uniformly pink. If it's releasing the hormone, there will be little bubbles of white around the edges where the thyroglobulin is actively letting go of thyroid hormone and releasing that into the blood. And then, as we mentioned, in these kind of roughly triangular spaces between the cells, between the follicles, you have yet a third endocrine tissue in the thyroid and parathyroid glands, and those are the C cells that produce calcitonin. So let's label this drawing here. We've got follicular cells that are producing the hormone T3 and T4. We've got C cells, or parafollicular cells, that are producing the hormone calcitonin. And then over here in the parathyroid, you have chief cells that are busy secreting the hormone parathyroid hormone. Okay, and in brief, we'll talk about this in much more detail in the next couple of slides, but in brief, the function of thyroid hormone is to regulate what we call basal metabolism. The function of calcitonin is to decrease blood calcium, and the function of parathyroid hormone is to increase blood calcium. Okay, that makes calcitonin and parathyroid hormone our first antagonist pair. That doesn't mean they sit in the blood and duke it out with each other like antagonistic siblings or something, or antagonistic politicians these days. It means more that they have opposite functions. If they were present in the blood at the same time, they would each be trying to get the body to do an opposite function. And for that reason, these hormones are regulated so that only one of them can be present in the blood at a given time. If the blood calcium is high, calcitonin will come out. If the blood calcium is low, parathyroid hormone will come out. You'd never see the two antagonists in the blood at the same time. All right, finally, to fill out our hormone cards for thyroid hormone. The stimulus for thyroid hormone release is thyroid stimulating hormone, or TSH as it's most commonly known. The gland that produces it, of course, is the thyroid gland. The hormones are T3 and T4. If you've been wondering about the 3 and 4, T3, triiodothyronine, has 3 molecules of iodine in it, where T4 has 4 molecules of iodine. As I understand it, T4 is the more stable storage form, thyroxine, whereas T3 is the more active form of the two. And T3 and T4 get interconverted back and forth between the two. So if you have too much of one, it can be used to make the other, and vice versa. Also, T4, thyroxine, is the one that can be clinically provided to a patient in the form of levothyroxine, a medication commonly known as Synthroid. Okay. The target of the thyroid hormone is pretty much all body tissues. Most tissues in the body, at least, respond to thyroid hormone in one way or another. And the effect on most of these is to increase what we call basal metabolic rate, or BMR for short. Your basal metabolic rate is the rate at which your body burns fuel or metabolizes fuel when you're not doing anything else. So when you're sitting on the couch watching Netflix, or sitting down watching this video right now, your body is working at its basal metabolic rate. Your basal metabolic rate has to be non-zero because your cells have to do basic maintenance for themselves all the time. But as mammals, humans have to keep our basal metabolic rate a bit above that as well, because we're warm-blooded. We have to generate our own body heat. And one of the effects of having hypothyroidism, of not having a high enough basal metabolic rate, is that you end up feeling cold all the time. Your basal metabolic rate also makes sure that your body has an abundant supply of ATP in all of the cells that keep your body going. So if you have hypothyroidism and a low BMR, you're apt to feel lethargic and perhaps even sleepy a lot of the time because you don't have enough ATP on reserve for your nervous system to just get up and go. And finally, the third effect of not having a high enough basal metabolic rate is that you don't burn enough calories over the course of a day. And so many people with hypothyroidism find themselves gaining weight when normally they wouldn't be. Okay, And finally, the pattern for this one is what we would describe as a multi-hormone cascade system with negative feedback. Having a sufficient amount of thyroid hormone in your blood feeds back to enough thyroid hormone feeds back negatively on TSH, causes the TSH level in your body to go down. And the reason for that is we don't want to wait. It takes a while for thyroid hormone to have its effect and for the basal metabolic rate to ramp up. We don't want thyroid stimulating hormone hanging around yelling at our thyroid to go ahead, produce more hormone, get the body warmed up, when the thyroid hormone is already there and just hasn't done its job yet. So thyroid hormone has an immediate negative feedback effect on thyroid stimulating hormone. Okay, so that was the complicated hormone in the thyroid system. Calcitonin is much simpler. The stimulus for calcitonin is an increase in blood calcium level. The thyroid gland senses a high blood calcium level. Remember, it's actually the C cells within the thyroid gland that are producing this. So the C cells sense a high blood calcium level, and they respond by secreting calcitonin. Calcitonin has a couple of targets. Its main target is the bones, and its main effect there is to have the to increase osteoblast activity and decrease osteoclast activity. If you recall, osteoblasts deposit calcium in the bone, osteoclasts remove calcium from the bone, so the net effect here is to store calcium in the bones. Okay. The other major effect is a more minor effect that calcitonin has is on the kidneys, and it causes them to secrete more calcium, or rather to allow more calcium out into the urine. The kidneys don't actively secrete calcium, they just allow it out into the urine. And the pattern here is this is a simple loop with negative feedback, as we would expect from a homeostatic hormone like this one. PTH is just the opposite of calcitonin. The stimulus is a decrease in blood calcium levels. Okay, when the chief cells of the parathyroid gland detect a low blood calcium level, they will release parathyroid hormone. It has this time a couple of targets, similar targets. The bones, this time we're going to increase osteoclast activity and decrease osteoblast activity. And the net result here is going to be to release calcium from the bones. We also have the kidneys, which are going to actively reabsorb calcium now. And they're also going to, the kidneys are also going to produce a hormone, a substance, I shouldn't really call it a hormone, called calcitriol, which you may recall is one of the active forms of vitamin D. And calcitriol is going to go to the intestines and actively scavenge up calcium from the food that calcium that we would not normally absorb from our food, it takes a good deal of effort for our intestines to absorb calcium, and so normally we don't absorb it very efficiently. Calcitriol goes into our intestines and more efficiently absorbs calcium. Finally, the pattern for parathyroid hormone is it's again a simple negative feedback loop. All right, that concludes my lecture on the thyroid and parathyroid. Hope you come back for the adrenal glands and the pancreas.